The link between food intolerance and digestive disorders is actually well recognized, and there's a good chance that FODMAPs are the culprit. So the first thing we need to clarify is what on earth is a FODMAP. Now, the acronym, as described by co-creator Sue Shepherd, stands for fermentable, meaning they're broken down or fermented by bacteria, oligosaccharides. Oligo means few and saccharide means sugar. Then you have disaccharides, monosaccharides, mono means single, and polyols. Now these are sugar alcohols, and not to be confused with ethyl alcohol, which is what makes you drunk. And that's why we're going to stick with the term FODMAPs. And if you digest them poorly, then they're going to ferment in your large intestine or your bowel and absorb water and produce gas. Now the result for someone who is particularly intolerant to FODMAPs can be stomach pain, stomach distension, constipation, or excessive gas or diarrhea. Yep, pretty nasty. Now, as you probably guessed, a low FODMAP diet is a dietary regime that strictly limits the amount of FODMAPs that you eat. It was first developed by Sue Shepherd and Peter Gibson at Monash University in Melbourne to treat what's known as irritable bowel syndrome, and has been clinically shown to work for 3 in 4 patients on average. More and more case studies and anecdotes of late have seen it now emerging as a potential treatment tool for several other health conditions like fibromyalgia, chronic headaches and migraines, and certain autoimmune diseases as well, particularly related to skin conditions. Okay, so how does a low FODMAP diet work? Well, FODMAPs are found in a wide range of foods, so it can be difficult to cut them all out without some assistance because A, you have to figure out what foods you eat that contain FODMAPs. B, you then have to figure out what foods you can replace them with so that you have something to eat. In fact, the diet is so restricted that it should only be temporary and should be viewed as more of a treatment tool rather than a lifestyle change. Okay, so to the nuts and bolts of it, for 3 to 8 weeks, depending on how you respond to it, you strictly limit or exclude as much FODMAPs from your diet as possible. This is known as the elimination phase. The idea is that with all FODMAPs out of your diet, it gives your gut bacteria a chance to correct any imbalances and also just gives your gut some time to heal. After the quite horrible elimination phase is over, you then get to move on to the reintroduction phase, and this is basically where you reintroduce one FODMAP at a time to see how you tolerate it. By doing this, you're able to see which foods or food types trigger your symptoms, and that way you know which foods you can eat and which ones you should avoid. And to just quickly cover a frequently asked question, is gluten a FODMAP? The short answer is no. Gluten can cause sensitivity in a handful of people, celiac disease or not, but gluten is technically a protein, and a FODMAP is a carbohydrate, so therefore gluten is not a FODMAP. Saying this word too many times. In saying that, gluten-free products do still appear beneficial for people who are sensitive to FODMAPs. Monash University do a lot of the research on FODMAP content in foods, and they find that gluten-free products have far less fructans and oligosaccharides, I think it is, than gluten-containing products, so gluten-free bread versus a regular bread. To sum that up, gluten-free products beneficial? Yes. Is gluten a FODMAP? No. If you'd like to learn more about FODMAPs and a low FODMAP diet, including things like very low and very high FODMAP foods, low FODMAP recipes, meal plans, probiotics, much more information like that, you can just follow the link in the description or on the YouTube card, depending on where you're watching this. If you found this video useful, please give it a thumbs up, and thank you for sticking around.